Good day. So for today, I'll be demonstrating transferring from bed to stretcher. So since we don't have a stretcher, we're going to improvise using another bed. So for first procedure is we're going to check the patient's chart or MAR or nursing plan of care, as well as their patient's limitation and if there are any tubes or IVs that are attached to the patient to safely transfer the patient to the other stretcher. And then next, we're going to perform a hand hygiene. After performing hand hygiene, we're going to identify the patient and explain the procedure to the patient. So, assuming that we've already done identifying and explaining to the patient the procedures, next we're going to provide privacy by closing the curtains. After closing the curtains, we're going to put a bath blanket on the patient. So let me just get the bath blanket. So, after placing the bath blanket on the patient, now we're going to check for the friction or losing linen or sheet. So since the friction reducing sheet is already been placed under the patient, next we're going to move the stretcher near the bed or to the bed. After that, we're going to need two assistants from other nurses. So guys, I need help. So after having two assistants, one on the other side and two on this side of the stretcher, we're going to count. Going to count 1 up to 3 to pull the patient. So 1, 2, 3. Next, after safely pulling the patient, we're going to check for the patient's comfort as well as their blanket. Next, we're going to leave these friction reducing sheet on the patient for return transfer. Next, we're going to check as well as clean the patient's transfer aid as well as do hand hygiene, and we're done. Good day. So now I'll be demonstrating patient transferring from bed to wheelchair. So first we're going to check the medical record of the patient to validate the correct patient is receiving the treatment and the correct procedure. After that, we're going to check for IV lines, incisions, at saka tubes to reduce the risk of injury. After that, we're going to assess the patient's limitation to better determine the best way to transfer the patient to the wheelchair. After that, I'm going to perform hand hygiene and put on gloves. So, let me just get my gloves. After performing hand hygiene doing gloves to prevent the spread of microorganisms, I'm going to identify the patient. So, assuming that I've already identified and explained the procedure to the patient, we're doing this to verify the patient is receiving the right treatment and to alleviate the patient's anxiety. After that, I'm going, if necessary or needed, I'm going to remove all the equipment on the side of the bed to make way for the chair. So, let me just push the chair in here. Close the bed. Now, I'm going to provide privacy for the patient and by closing the curtain. After that, I'm going to lower the bed as much as possible and also lifting the head of the bed. After that, I'm going to make sure that the bed brakes are locked. After making sure that the bed brakes are locked, I'm going to ask the patient to sit upright. So, sir, could you please sit upright? Okay. This facilitates patient independence. After that, I'm going to lower the side rails. After that, I'm going to ask the patient to move their feet on the ground. Sir, could you please move your feet on the ground, please? Okay. After doing that, I'm going to stand in front of the patient and check for any imbalance. So, okay. Since the patient is balanced, so typically is not, or there is no risk for falling. So to provide the room for warmth, as well as privacy. After that, I'm going to give the patient a non-slippery slippers. And after that, I'm going to give the patient a gate bell. After that, after securing the gate belt, I'm going to ask the patient to move his buttocks on the edge of the bed. Okay, now let's carefully put these two on the patient's leg. Next, I'm going to ask the patient to stand up while I'm assisting the patient. So, sir, could you please stand up in count of three? So, 1, 2, 3. Okay. Next, after that, I'm going to assist the patient until the patient was able to feel the edge of the wheelchair. So, sir, okay. Once the patient was able to feel the edge of the wheelchair, I'm going to ask the patient to sit down and move their hands on the armchair. And then, further, I'm going to assess the patient if the patient is in center of the chair and remove their gate belt. After that, I'm going to clean the transfer aids. After cleaning the transfer aids, I'm going to remove my gloves and perform hand hygiene. And that's all.